Hello everyone. Today we are going to talk about thoracic and cardiovascular surgery. Now, medicine and surgery have developed a lot in recent decades, including cardiothoracic surgery. It is known that the chest area is one of the most dangerous areas that can be operated on, although it is full of important organs in which a defect may occur that requires surgery, or that there is a congenital abnormality that requires repair, such as congenital heart defects. So what is cardiothoracic surgery? What are the techniques used in it? What are the chest diseases that respond to surgery? And finally, the complications arising from it. You will learn all this and more in this video. So our role today is to answer most of your questions regarding thoracic and cardiovascular surgery. Today we have Doctor Seong, who is the leading doctor at Ewha Seoul Hospital. He is going to discuss with us everything about thoracic and cardiovascular surgery from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Seong. Nice to meet you.
Nice to meet you.
Dr. Seong, can you please briefly introduce yourself?
Yeah, I am Seoul, the thoracic surgeon. It's very nice to meet you.
Okay, so straight to the first question. So lung cancer, what is it exactly?
Cancer can occur in all parts of the body, and lung cancer is a disease that causes cancer in the lungs. Lung cancer is treated very importantly. This is because if lung cancer is detected late, treatment results are not good. Lung cancer is a very important disease to detect and treat early.
So what are the first symptoms of lung cancer, if there are any?
There are many symptoms of lung cancer, but just because the symptoms appear does not necessarily mean that lung cancer has developed. Symptoms of lung cancer include coughing, hematitis, and voice changes. Not all patients with lung cancer suffer from these symptoms. Therefore, even if there are symptoms, lung cancer does not always occur, but the symptoms of lung cancer usually include coughing, hematitis, pain, and voice changes.
So usually what is the diagnostics that helps identify if there is lung cancer?
Chest x-rays are performed to diagnose lung cancer. If an x-ray finds a lump in the lungs, we suspect and examine lung cancer. The most sensitive test is CT. In recent years, many CT tests are performed, and lung cancer can be detected early by performing imaging that reduces the amount of radiation when a patient undergoes regular checkups. Other accurate diagnoses are made through biopsy. A biopsy may be performed through a bronchoscopy tissue, may be obtained using a needle or septum diagnosis.
So the diagnostic, how is it different from other lung diseases?
The difference between lumps and lung cancer in other common lungs is that several diseases may be associated with lumps. Non-cancer general lumps or inflammation may appear in the lungs. Cancer is a disease that proliferates endlessly, so it is different from humps. Tuberculosis species that look like bumps due to tuberculosis and other positive bumps sometimes appear in the lungs.
So doctor, how many stages does lung cancer have in general?
In general, lung cancer is divided into stages 1 to 4. Stage 1 is small in size and occurs only in the lungs. In the second phase, the hump spread a little more around the lymph nodes, and in the third phase, the lymph nodes around the hump spread to the lymph nodes in the chest. Stage 4 is a state in which cancer cells spread throughout the body.
So in the case of like cancer, what are the treatments that can be used?
Treatment of lung cancer is largely divided into two categories. It is surgical treatment and medical treatment. Surgical treatment is a method of incision of cancer as a surgery. And medical treatment includes chemotherapy injection, drug, and radiation therapy.
So talking about surgery, what is exactly thoracoscopic surgery? And in what stages is it used?
In the past, cancer was incised and cut out in a traditional way. However, due to the development of science and the development of imaging, a method called thoracoscopy was developed. This is using a stick-shaped camera, which you can put in the chest to take a good look at the inside. And through this, you can easily proceed with the operation. Compared to the past, the level of surgery is the same, but the patient feels comfortable because of the advantage of making a much less incision to the skin. In the case of patients in the first and second stages, performing surgery is more effective than medical treatment, and in the early third stage, surgery is more effective. However, in the case of the late third and fourth stages, medical treatment should be performed before the surgery.
So does it have any advantages over classic surgery?
Yes, comparing general chest incision surgery and thoracoscopic surgery performed in the past, the advantage is that the patient feels comfortable due to the small incision range. Patients feel less pain and recover quickly. The body produces hormone secretion or inflammatory reactions to incision, and this response is reduced by interposing incision, and the patient's recovery is fast. When the thoracoscopic surgery was performed for the first time, several holes were made, but it is now called a single pot surgery and is developed into a method of making only one hole and using it.
Okay, so usually what causes lung cancer? Is it heredity? Is it smoking? Is it lifestyle?
It's a difficult question, and it's a problem that hasn't been solved well. What is the reason for lung cancer? In the past, it was argued that cigarettes cause lung cancer. And it was also true that cigarettes cause a lot of lung cancer. Recently, however, cigarettes' non-related lung cancer has been found, and such patients account for more than 60% of all lung cancer patients. Since lung cancer in the past and lung cancer in the present have not only causes but also other factors, it is carefully assumed that there are different types of lung cancer. The causes of lung cancer include cigarettes, passive smoke, genetic factors, and other environmental factors. And pollution and even speculation is that lung cancer may occur due to smoke generated when cooking at home. It is thought that lung cancer is caused by a combination of causes.
So how can an individual prevent lung cancer?
Since several factors mentioned just now can cause lung cancer, it is recommended to eliminate these factors. However, this alone cannot completely prevent lung cancer. If the cause of lung cancer cannot be eliminated, it is also best to detect and treat lung cancer through regular checkups if you have a large number of lung cancer factors due to environmental and genetic factors.
So passive smoking, can it result in lung cancer?
There are many studies and papers that say passive smoke can cause lung cancer. It is said that the risk is about twice that of general factors. I would like to say that it is better to avoid passive smoke as much as possible.
Okay, so can you tell us what is so special about the Department of Thoracic and Cardiovascular Surgery at Ewha Women University Hospital?
Ewha Hospital's Chest Surgery Lung Cancer Center is an enterprising and cooperative department. It is a system that allows patients to be treated quickly and discusses the direction of patient treatment through collaborative treatment every week when lung cancer patients occur. Thoracic surgery is actively performing thoracoscopic surgery and allows patients to recover quickly through single-port surgery. The treatment results are judged to be similar enough compared to other hospitals.
Great, that was it. Thank you, Dr. Seong.
Thank you
so much. Today we learned many things about thoracic and cardiovascular surgery, and the doctor explains in details everything related to this important kind of surgery. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and respond to you as soon as possible.